All right, welcome everybody. This is our first of two editions of Who Are You and Why Did You Join Renew? I want to introduce everybody to Dr. Matt Fischer. He is a graduate from South College and joined our team actually late last year. And what I wanted to do is take some time for people to get to know our team, let you guys know who's working with us and why we're working together and what our MO is, what our goals are. And so, Dr. Fischer, you graduated from South College and you're also certified in a couple things. What is it?
Yeah, so I am functional movement screen certified, which is FMS for short. Originally, it was used as a injury prevention or injury risk assessment tool, and then I'm also a CrossFit Level 1 trainer. Have been doing CrossFit for a number of years now, and have really loved treating a bunch of CrossFit athletes. So.
Awesome. Okay. And so what I want to do right now then is talk a little bit about you personally. If someone asks you, who are you and what do you do? And, tell us about your life. What are the top few things that you love to let people know is important to you?
That's a great question. I, I would say unique in a way. I've been through a lot of different things, seen a lot of different things. Basically, growing up, I was born in Evansville, Indiana, so very southern tip of Indiana. I eventually, graduated high school, all of that, made my way to Kentucky for my undergrad, and then finally to South College in Tennessee to receive my, doctorate in physical therapy. Growing up, everything sports related. I mean, if it had a ball, if you could score it, shoot it, that's what I was into. Very competitive person. Fell, into a bunch of different teams. And then even when I was in college, I had the opportunity to be a collegiate rower. And that kind of set me down a whole different path as well. And now kind of in the CrossFit space, if you will. And like I said, I kind of love the methodology that they preach and teach, and just find myself in a good group of people, whenever I'm around them.
So with all the sports and that you played, rowing was the one that you chose. Now, no one really knows this, but you're pretty tall. What are you, like 6'2"?
Yeah, 6'2".
Okay, and sometimes you don't. It doesn't come across that way. And then we see how. Okay, there you are. You never played basketball? I didn't hear you play.
Yeah, I definitely did play basketball growing up. So
you went to Kentucky. You didn't make the team?
Yeah. Three main sports was baseball, basketball, and football. I would probably say I was best at basketball. And I don't think it was because I was tall. I guess I just had a good shot. I could kind of move the ball really well, good ball handler as well. But I'd say my favorite sport was actually football. I was a wide receiver and also a safety. And the thing I loved about being a safety was you could kind of you sit back and you kind of read the quarterback, and I love to get in their minds a little bit and play that kind of mental game with them, where they're going to throw it, where they're not. And so I love that. Obviously, putting on some big hits on people as well. And definitely played basketball, but eventually got into college, and someone kind of grabbed me and said, "Hey, you're coming to join the rowing team." And I was like, I don't even know what rowing is. And so they kind of introduced me into it. And, eventually found out, it's the Olympic sport, all of that, and just kind of got entrenched in it, just fell in love with it. So
that's interesting. I grew up playing football, basketball, baseball, and it wasn't until high school did I get really involved in track. And I ended up going that route because I never grew, and I was like, I'm not getting hurt, and I'm just going to run away from things.
Yeah.
And it worked out just fine. And then so state level runner, and then I burn out, and then I get changed in college because I was sick of running so much, so I started doing martial arts.
Oh wow.
And so it's interesting how you've morphed in your interests as well, going from the ball sports to now you were doing rowing, and now you're a little more in the CrossFit area. Yeah. It's interesting how our interests change over the years.
Yeah, it really is. And I had no intentions of kind of people have just drugged me into these different things. They're like, hey, you need to check this out. And I'm like, okay, I'll go and see what it's about. And then like, I'm kind of one of those people is if I get drugged into something and I kind of like it, I'm kind of 100% all in. I just jump right into the deep end. And so, that's kind of my style and everything. But
Okay. Tell us more about yourself. I understand you have a family.
yeah, I sure do. I have a lovely wife. Her name is Lauren, and we just had our first baby. She is 8 months old. Baby Callie is her name, and she's a beautiful little girl. And we are absolutely delighted to, welcome her into our family. And we've been.
You said we just had a baby. It's been 8 months, bro.
I guess
She's almost a toddler now. I'm sure
yeah,
she's getting around a little bit. So
that's true. She's still kind of new, into our lives and
yeah,
things. But yeah, she's an absolute joy to have, and we've been very blessed as parents with her. So
good. So let's talk professionally. So when you after you graduated, I know you went on a job search. What did that process look like for you?
oh man, it was interesting. My wife and I were in Tennessee at the time. Weren't sure where her career was going to lead, and so I was kind of looking in Tennessee. We also had prospects that we could be down here in Florida, and so I was kind of just searching really everywhere, trying to get leads into places I wanted to work at, what fit my style, things like that. And eventually we found out that we were moving down here to Pensacola and Panama City. And so I started looking down here and, eventually obviously found the Renew family and interviewed, with you. And it was, everything just clicked just right. When things are right and your gut is telling you, yes, this seems like this is what you need to do and where you should go. That was kind of the whole process. And from kind of even being in school, I kind of knew that I didn't want to go the traditional therapy route. I had kind of worked up, in that system, and I knew there was something better out there. I just didn't know what it looked like. So
So then you said like there's better out there. What were the problems that you saw in the traditional model that was not appealing to you? And for our viewers, obviously with Renew, we're a self-pay, cash-based practice. We don't actually work with insurance, which is somewhat of a surprise to many people. What was it that you were afraid of in the traditional model that you wanted to stay away from?
I think, even being a rehab tech and, just observing other physical therapists, they were seeing so many patients a day. It was the volume was just so high. You almost didn't even have a chance to sit down with them and have a conversation. And I just didn't like that. I thought therapy was this, hey, I'm gonna walk alongside you. I'm gonna know kind of everything about you. That way I can help you the best. And I just saw that healthcare, as I was, kind of traversing in my career, that it was kind of going away from that, less personable and more business oriented. And I just didn't like that. I'm a very personable myself, and I love communication. I loved getting to know people, and that's where I wanted to be. But like I said, no one else out there was doing that, so it's kind of difficult.
Yeah, that was one of the hardest things about it for me. I'm surprised I survived for 10 years, but as a traveling PT before I settled down, I always felt like, well, maybe next time it'll be better. And maybe that was just a bad clinic, or maybe, and I finally found, and this was the kicker for me, is I found an awesome boss to work for out in California when I was there. And he bought us Starbucks every other day. He, really praised us. He supported us, and he was fun. There was no strife in the office. He really was a great leader.
Yeah,
But the clinic still operated the same. It
yeah,
was still every half hour we had patients coming in and out. And, gosh, my boss was even kind enough not to give us a hard time about productivity standards and you aren't building enough or whatever. But the clinic still ran the same. And, I was seeing like 14 to 16 people a day. And I don't know, I feel like I'm a sucker for doing it for so long. Meanwhile, you're like, boom, I'm not doing that.
Yeah. I
You're ahead
saw
of the curve by about 10 years.
Yeah, I
Um,
saw a little taste of it, and I was like, I just knew in my heart and in my soul that I couldn't do that. It almost felt like morally, I wouldn't say morally wrong, but it just didn't sit well with my heart and who I was as a person. I thought people could get served better and be in more of that preventative type of state rather than someone gets injured or they have all these comorbidities coming in to therapy and they have all these things stacked against them, and trying to walk alongside them and help them navigate their own health. That's kind of where I wanted to be.
yeah, I understand. So then what was it that attracted you to physical therapy versus personal training, occupational therapy, physicians? Like what was it the PT was special in that you were like, I want that?
I think, initially when I was observing a lot of physical therapists that I knew, I had a bunch of great mentors, growing up, and it only got reiterated in school more and more. But being able to talk one on one with each patient, I love that aspect of not only being able to help them with their problems, but get them out of pain, help them function and live like a life that is worth living.
Mm.
Because people come into the clinic with pain, but that's not what their main goal is. Their main goal is to get out of pain to do something else, um,
Yeah.
and that's what I want to know about them. Like, what is it that when we get you out of pain, what are
hmm
you wanting to do after that? Because that's what I want to know. That's when you can make that connection with people.
Yeah. Sounds like a lot of what drives you is that relationship more than mechanics and muscle tendons and whatnot.
Yeah. I definitely I'm a big anatomy, physiology type of nerd. I've always kind of been that way. Even in my undergrad, I was biology, chemistry. So I am kind of that nerdy type. But, uh, as I've gotten further and further into the career, I've noticed, less and less of how anatomy kind of matters, or at least not less and less it matters, but there's another like 50% of what patients tell you that you can use to help them.
hmm
At first I thought, okay, 100%, everything's 100% anatomy. I'm going to go in there, do this, do that, and I'm going to fix them. Whereas now I'm basically helping them fix themselves, if that makes sense.
Yeah, that's exactly right. What you're hitting on is the fact that we are emotional beings, that we are actual personable beings. We're created to be in relationship with one another.
Yeah.
And that relationship, that trust matters. I mean, there's a process and there's a bone that needs to be manipulated. There's a muscle that needs to be rubbed and all these exercises that need to be had. But those seem to be they're just tools in
Yeah,
order to help you along the journey. And
exactly.
the journey is a process, and the relationship is what gets you through it.
Exactly.
And that's my vision. That's our vision for Renew, is not to have this rote exercise protocol that, okay, we're just going to go do it, but you hang tight there, I'm going to go and check this person out. Like, that's not where our heart is. Our heart is actually to get to the root of the problem, help you along that road, and build relationship while we do it.
Exactly.
And honestly, the compliance, I mean, people in the medical world talk about compliance. It's a big deal. If the patient or the client, if someone who's going through this journey is not buying in, the problems arise
Yeah.
from that. So that's nail in the head right there, man.
Yeah, exactly.
So tell me this then. So we've got this self-pay practice. So now that we kind of know what you ran from, it seemed like the biggest problem was the productivity.
Mhm.
What was it that attracted you to this model? Because as you're learning, as I know, like it's nothing like a traditional model. What Because it's got some flaws, it's got some things that we need to work through that isn't natural to us. What is
Mhm.
it about that actually attracted you to it?
I think one of the biggest things, and I think you hinted at this earlier, is that um, we have the freedom literally to do whatever we feel is appropriate for our patient. Whenever you're working under the guidance of insurance or an insurance-based, therapy clinic, you are kind of told what you can and can't do. They have a shoulder problem, you are only allowed to touch the shoulder. I don't care if there's anything coming from the neck, the mid back, the low back, you're only allowed to touch that. And people's problems are multidimensional, multifactorial. And I like that freedom to be able to look at the individual as a whole and see what different problems might be in conjunction with their main problem. And just having that freedom and no one breathing down your neck and saying, "Oh, you got to see this many patients, and it's you got to do this, you got to fill out this documentation, this, that." Just having the freedom, I can't tell you how nice that is. My documentation takes like 5 minutes, if that, and
Five
it's
minutes? What are you,
yeah.
writing a book?
Yeah. I know. I'm not as
Yeah.
quick as you are, just doop, 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 and done. But
Yeah, I know. I'm a lot less detailed for sure. But actually, I like what you did with your documentation. You went the more horizontal route. I'm gonna totally copy that.
yeah,
It makes a lot more sense.
in my
Um,
mind, I'm a list type of person,
yeah,
and
man.
here's problem, here's what solution, and then what exercise can we help correct that problem,
Yeah.
that issue that we just fixed. So I like that linear kind of like model. But yeah, yeah,
Yeah, I know when we first interviewed, you were like, you just use a Word document. I'm like, yep. The reality here is when we don't have to answer to insurance companies, we can spend a lot less time writing stuff down and worrying about the electronic medical record, and we can just go straight to the problem and spend more times with our hands on the patient. What other things attracted you? So you loved the idea of spending more time with patients, and the documentation was really good. What other things were the freedom to do what you want? What are the good things that you felt like was important for you and your soul, going out of getting yourself away from the insurance world?
I think one of the biggest things too is, at least for me, is work life balance. Obviously having our new baby, things can arise very quickly. Things change on a daily basis, and being able to flex and say, okay, I can go pick her up for an hour here, or go run her by the doctor real quick. That flexibility in the schedule. Whereas whenever you're in a traditional clinic, you are there 8 to 5, no
Yeah.
matter what, and you're probably staying an hour or two later to finish your documentation. So I mean, yeah,
You wouldn't know, but that's a true statement. Uh,
yeah,
I I remember there's one clinic I worked at that I lived a little further away from, so I always left like on the dot. My patient was done at 4, I left at 4, but I'd always come in early the next day to finish my paperwork. And then that's not including the time we spent wolfing down your food while documenting from the morning.
yeah,
And that is just it's not a way to live.
yeah,
I always tell people I didn't go to get my doctorate degree to be a slave to an insurance world. And to be honest, it's not the clinics, it's not the owners. I never want to impugn the integrity of other colleagues, because most of the time we're all just have the same heart. When we talk about physical therapists, we all just thrive on the relationship and the building of strength and getting people to meet goals. I mean, that's kind of what attracts people to physical therapy like yourself. And so most of the time when there's a poor quality out there, it's usually really awesome clinicians being tied with their hands behind their back, trying to figure out how to treat 3 people at the same time or whatnot.
yeah.
And
It's
yeah, go ahead.
Yeah, I was just saying, it's the system that they're forced to work in. It's like a round peg through a square hole. Sometimes whenever you try and you are a good clinician, you do work really hard, but the drags of what your job requires, doesn't allow you to give your full self to your patients, your clinic, etc. So it is a broken system, and that's what I kind of envision us kind of changing in a way, is a new way to look at physical therapy and what it should be and what it can be.
Yeah. And then, it's interesting. You said it's a broken system. It's exactly right. But the system's not just broken for physical therapy. I mean, the reality is no one's got there saying we have a great medical system. Now, listen, all politics aside, everyone agrees that what we've got going on isn't necessarily working. And so what we're trying to provide is a way of looking at medicine as not so much as I am owed certain things, but I'm going to take the power in my own hands. I'm empower myself, and I'm going to be the driver of my medical world. And I think we see a lot of that in our country, where it's the opposite, where my doctor said to do this. And, I mean, gosh, we have Google, and Dr. Google doesn't know everything, folks. But I will say this, just researching the process of how things work, what's a good outcome to expect. I mean, there's so much material on YouTube on like total knee replacements. Like, what are we going to do? What can we expect? What's the best thing to do? Who's the best doctor? There's so much information out there that I'm not saying go out and diagnose yourself, but be familiar with the process is a much better thing to use. And I just think that we live in a country that still has the best medical care in the world, but not even close. But at the same time, it has a lot of flaws.
Yeah.
And, if you want to speak to it, what are your thoughts on what we're doing to change health? So it's really sick care is what it is, right? We have sick care, and what we want to do is actually go in the route of true health care. How do you see Renew doing that?
Well, just like you said, it has a little bit to do with the patient taking ownership of their own health. As a physical therapist, yes, I'm going to do certain things and help you along. But it's really you healing yourself. When it comes down to it, it is your body healing itself. I'm just the person kind of helping it guide along.
Mm-hmm.
And, going back to sick care and, kind of that whole realm, when I was in school, I did a rotation in acute care hospital. And I've never had a more eye-opening experience of people being truly sick. And I always thought to myself, I was like, man, it was interesting, but how can we prevent people from getting here? And, in the back of my head, I was like, maybe, what if all this started that they had a bad back and then they just started sitting more, and then they got poor diet, poor nutrition. They started sleeping less, and it just cascaded from there. And that's really, at least at my heart, I'm trying to do more preventative type of physical therapy, making sure that people, whenever they do have a bad back, recover really, really quickly, so they don't fall down that path, because it's very, very easy in our world and our society to fall in that path. And I think that's kind of where I see us, heading, and trying to make people, take ownership of their own health, and, be a forefront, not just rely on the doctor saying, oh yeah, this is the way it is, and this and that, but really being an advocate, for themselves in a way, because that is honestly so important. So.
Yep. And, a professor told me this when I was back in school, and it's still true today. You don't grow old because you don't stop moving because you grow old.
Yeah.
You grow old because you stop moving. And the question is, why did you stop moving? Some people lack purpose. They retire and they're like, okay, what can we do to motivate people to have a new purpose or a new activity or something else to do while they're retired? Or maybe you do stop moving because your back hurts, or there's a number of things that we address as physical therapists that go into that. And and really, there's so much we can do in a preventative way to get people 10, 15 years prior to being in the hospital, sick, or better and not let them become so sick. And even if, and I always tell this to people, is if you go into surgery with a lot of strength, you're coming out with a lot of strength. You go
Yeah.
in with a lot of range of motion, you're going to come out with a lot of range of motion. So there's lots of things we can do even before any kind of surgeries happen anyway.
Yeah.
But you're right. We end up being much more reactive to issues instead of preventative. I can't tell you how many times I've heard, "Yeah, I fell last night, but I'm okay. I'm not. I don't need anything." It's like, no, we can help you. Like, let's make sure that doesn't turn into a fracture next time. And these are the older folks, but there's still like the younger folks that go, yeah, every now and then I wake up with my neck a little stiff and a little bit pain, but it goes away. No, you just don't feel it.
Yeah.
And I think that's where a lot of people go wrong, right?
Oh yeah, absolutely. Yeah, it's even the younger generation, obviously with technology, phones, and now these days, we see younger and younger people every single day, especially with posture related dysfunctions. And I only think it's going to get worse and worse as technology advances and more people are apt to be on their cell phones and their computers. But yeah, yeah, you're totally right.
Well, Matt, yeah, listen, I really enjoyed this conversation. I hope our viewers, you guys enjoyed this, getting to know Dr. Fischer and listening to what our thoughts are about the healthcare world. Listen, I am really happy that you've joined my team. I'm really excited to see where your career goes because I think it's a very bright one. I really believe as we move forward with Renew, we're gonna continue to build on something that we started this year that's going to really blossom into a pretty large movement. And even though there are others doing things similar to us, we are still on the ground floor of creating a true healthcare system, sprouting out of the sick care system that we're trying to leave behind. So, Dr. Fischer, thank you so much for taking the time and spending with me today.
Hey, absolutely. Thank you for having me.
Love it.